Hello, today we will talk about intervertebral disc herniation. This information is for informational purposes only. An issue with one of the rubbery cushions that lie in the spaces between the vertebrae that make up your spine is referred to as a herniated disc. A spinal disc has a harder, rubbery shell covering a softer, jelly-like interior. A herniated disc, also known as a slipped disc or a ruptured disc, happens when a portion of the nucleus slips through a rip in the annulus. Although a herniated disc can develop anywhere along the spine, it most frequently does so in the lower back. A herniated disc may cause discomfort, numbness, or weakness in an arm or leg, depending on where it is located. Many patients with herniated discs don't have any symptoms. For those who do experience symptoms. Although they can sometimes develop in the neck, herniated discs typically occur in the lower back. The location of the disc and whether it is pressing on a nerve will determine the signs and symptoms. One side of the body is typically affected by herniated discs. Leg or arm pain. You may experience discomfort in your buttocks, thigh, and calf in addition to lower back pain if your herniated disc is in your lower back. Your foot may also be bothering you in some areas. Your shoulder and arm will often hurt the most if you have a herniated disc in your neck. When you cough, sneeze, or assume certain positions, this pain may radiate into your arm or leg. Sharp or searing pain is a common description of pain. Tingling or numbness. Radiating numbness or tingling in the body portion serviced by the injured nerves is a common symptom of a herniated disc. Weakness. Affected nerves tend to weaken the muscles they service. This may impair your balance or make it difficult for you to lift or hold objects. A herniated disc might exist without any signs or symptoms. It's possible that you won't be aware of it until a spinal scan reveals it. When to see a doctor. Seek medical attention if your neck or back pain travels down your arm or leg, or if you also have numbness, tingling, or weakness. Whenever to visit a doctor. Consult a doctor if your back or neck pain radiates down your arm or leg, or if you also have tingling, numbness, or weakness. Risk elements. A herniated disc can develop as a result of several factors, including weight. The discs in the lower back are put under more strain when a person is overweight. Occupation. Those who in physically demanding occupations are more likely to experience back issues. Herniated disc risk can also be increased by repeated lifting, pushing, pulling, side bending, and twisting. Genetics. Herniated disc development is predisposed in some people by genetics. Smoking. Smoking is thought to reduce the oxygen supply to discs, hastening their decomposition. Driving frequently. The vibration from the motor vehicle engine paired with prolonged sitting might put pressure on the spine. Being inactive. A herniated disc can be avoided with regular exercise. Complications. Your spinal cord comes to a stop just above your waist. The cauda equina, a collection of lengthy nerve roots that resemble a horse's tail, extends into the spinal canal. Rarely, a herniated disc might compress the cauda equina nerves as well as the entire spinal canal. In rare cases, immediate surgery may be necessary to prevent paralysis or lasting disability. Obtain immediate medical help if you have symptoms getting worse. You may have pain, numbness, or weakness that interferes with your everyday tasks. Bowel or bladder problems. Even with a full bladder, cauda equina syndrome can result in incontinence or difficulties urinating. Saddle numbing. The inner thighs, back of the legs, and other regions that would contact a saddle are all affected by this gradual loss of feeling. Prevention. Do the following to help prevent a herniated disc. Exercise. By making the trunk muscles stronger, the spine is stabilized and supported. Maintain a straight spine. Your spine and discs are under less pressure as a result. Maintain a straight and aligned back, especially when sitting for extended periods of time. Lift large objects correctly, putting most of the weight on your legs rather than your back. Keep a healthy weight. Extra weight puts extra strain on the discs and spine, increasing the risk of herniation. Thanks for watching. Subscribe to the channel and click on the bell so you don't miss new videos.